I'm Dr. Sisech Tuluza, the Executive Director of the Joint Clinical Research Center. I welcome everybody to join us in celebrating 20 years of collaboration with Pepfar. We thank Pepfar for accelerating the JCRC work and saving millions of lives in Uganda. And we also thank all our implementers that we have worked with to implement Pepfar projects in Uganda. By 1990, Uganda had the highest prevalence of HIV in the world. There were many deaths happening in this country, and there was an escalating number of orphans due to these senseless deaths. Uganda had a multi-sectoral response to address the HIV epidemic, led by His Excellency the President of Uganda. And in 1991, Joint Clinical Research Center was founded by His Excellency to find a scientific solution to the AIDS crisis. While in 1996, effective treatment was available in the West, there was nothing available in low-income countries. To address this dire HIV situation in the country, JCRC pioneered ART in sub-Saharan Africa through a research project in 1992. The center also started to provide antiretroviral drugs through operational research, sponsorship programs, compassionate basis, and a cost recovery program. Besieged by thousands of dying patients, JCRC imported generic antiretroviral drugs. In 2000, the number increased dramatically that could afford these drugs, and the JCRC set up clinics around the country, which they called the JCRC network model. The JCRC network model became a case study that informed the architecture of Pepfar, and JCRC was one of the 2 case studies to showcase that ART could be provided in low and middle income countries, and this provided evidence for the Pepfar setup and approval. Subsequently, JCRC received the first Pepfar grant in the world and rolled out ART in Uganda under a program codenamed TREAT. The JCRC was also able to establish 6 regional centers of excellence to support the national rollout. In order to break stigma as we introduced ART, we needed intensive community participation, information, and communication. And we did this by marching through the cities where we opened the clinics. We had edutainment by different groups, including our very own, the Stigmaless Band. In order to increase ART access, we had to address infrastructure issues. In some of the clinics, we did not have space, so we started in tent as we built the infrastructure. We had to deal with the data management, and we introduced computers and proper archiving, and including renovating the clinics that we found that were very debilitated. Our program reached even the most remote areas in Karamoja, and some of the clinic visits we went with the USAID staff, including the US Ambassador to Uganda, Jimmy Coker. So as we rolled out treatment, children's medicines lagged behind the adults, and through our research in collaboration with others, we evaluated a fixed dose combination tablet. So the children, instead of taking so many bottles of syrup, took 1 tablet a day. And also Ban Ki-moon was at JCRC when we were launching the first ever pediatric Kaletra in sub-Saharan Africa.
JCRC established regional centers of excellence, which are the laboratories, to support the national ART rollout. We pioneered CD4 testing, early infant diagnosis testing, and viral load testing as part of the ART program. JCRC was able to attain the highest level of quality assessment through CAP accreditation.
JCRC is one of the high-volume sites in the Kampala-Wakiso area. We currently have 13,190 clients across the first, second, and third line regimens. 96% of these patients are on the first line regimen. Because JCRC was the first facility to provide ART, we have the oldest cohort of patients. For example, 36% of our patients are above 50 years of age. Of these 13,190 patients, 97.8% of the patients are virally suppressed. So JCRC Lubowa was also the first facility to offer third-line antiretroviral drugs to patients who had extensive drug resistance mutations and who had deteriorating health. JCRC, working with the Ministry of Health through capacity building and training, has assisted in the rollout of third-line treatments to the regional referral hospitals countrywide. JCRC also has one of the only 2 labs in the country that performs drug resistance testing. Our lab is actually a College of American Pathologists certified, and Pepfar actually gives us funding to provide drug resistance testing on patients who have failed on second-line ART treatment. Currently, this resistance lab is also involved in conducting research. We are currently conducting an HIV drug resistance surveillance research on patients living with AIDS who are on a dolutegravir-containing regimen. And the main goals of this research, first of all, we want to detect mutations to dolutegravir early enough so that we can inform the national program.
The USAID Local Partner Health Services supports 2 regions, Kigezi and Lango. In here, we support over 140,000 clients on care and treatment. And against the Pepfar targets and UNAID's targets, we are doing well, surpassed our targets, the 95, 95, 95. We've currently achieved 93, 97, and 84%. We implemented DREAMS program targeting adolescent girls and young women, mainly preventing HIV infections and unwanted pregnancies. We've surpassed our enrollment targets, providing them with key services that they need, and we've also provided education subsidies for the girls to enable them remain in school.
Strengthening public health lab systems in Uganda, a project under JCRC, is working to strengthen lab systems, establish diagnostics networks in the country, support disease surveillance and outbreak investigations. Our coverage is in 126 districts in 100 hubs. Since our inception, we have supported the country to accredit 27 laboratories. That makes the total number of accredited laboratories in the country to get to 72. To ensure sustainability of quality systems, the project has supported the functionalization of the Uganda National Accreditation Services, which is the national body to oversee quality systems in the country. And because of our efforts, we have been recognized by the Ministry of Trade for all the support, the technical support, and the services that we have offered in that regard. The project has supported the National Calibration Center to perform their role through expansion of the premises, and through expansion, then they're now able to calibrate a number of equipment more than they used to offer in the past. At the same time, capacity building to the human resource within the calibration center, which has enabled them to handle more equipment than before. Our project has also strengthened the structure and the documentation with the aim to support biosafety and biosecurity in the country. And that is through supporting the Ministry of Health to write different policies, guidelines, training of resource persons in the area of biosafety and biosecurity.